Good morning and good afternoon for guests that are joining us from far and wide. As people are signing in, please do feel to click on the Q&A box at the bottom of your screen and let us know that you're there. Tell us where you're connecting from and perhaps provide a little comment on the weather. Hello and welcome to this webinar, Building a Strong and Resilient Health System in Ghana. I'm Julie Hard, International Relations Manager for the Faculty of Health at York University. And thank you for joining us today to learn about York's nursing education collaboration with the University of Health and Allied Sciences, or UHAS, in Ho, Ghana. In today's webinar, we will introduce you to the Ascent program, so named for its goal of advancing scholarship and capacity for emerging nursing doctorates. In a moment, we will have a welcoming message from York University's Vice President of Research and Innovation, Amir Asif. We are also very grateful to have with us the Vice Chancellor for the University of Health and Allied Sciences, Professor John Owusu Japiong, who will be opening the webinar formal program with his remarks. Today's webinar will focus on hearing from the people most engaged with the Ascend program, to learn about its impacts through a panel discussion and an open Q&A session where we hope to hear from you, our guests. Paul McDonald, Dean for the Faculty of Health at York, will highlight key messages heard throughout the session towards the end of the webinar and provide our closing remarks. If you need help with the Zoom webinar, please feel free to click on the Q&A button at the bottom of your screen and enter your question. Our team is there and is ready to help you. That same button can be used to submit questions for our guest speakers to answer during the Q&A period following today's panel discussion. In Canada, we're at the beginning to take a long, hard journey of truth leading to reconciliation with our Indigenous communities related to the historical traumas caused because of colonization. We will begin this webinar with the traditional practice of recognizing and expressing gratitude for our shared spaces through a land acknowledgement. As this event is virtual, and we are not all gathered in the same space or even within the same country, I recognize that the following land acknowledgement might not be for the territory that you are currently on. And if this is the case, please take the responsibility to acknowledge the traditional territory you are on, the current treaty holders, and the Indigenous people who have been its historical caretakers. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaranto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. That dish has three simple teachings. First, never take more than your share. Second, make sure there's enough food to go around for everybody. And third, don't foul the dish or take the dish. We say these words to acknowledge the territory we are gathered on and the history of the land and the peoples who have come before us. Whether this is the first time you've heard it, or if you're already familiar with it, we encourage you to learn more about the history of Indigenous people in Canada. We also extend to everyone an invitation to reflect on the land acknowledgement's message of sharing, caring, and joint responsibility, which are important more than ever as we continue our efforts towards cross-cultural learning and international understanding. At this time, I would like to call upon York University's Vice President of Research and Innovation, Amir Asif, and Vice Chancellor Professor John Owusu Japiong to turn on their cameras.
Hi, Julie. It looks like we're having some technical issues with the Vice President of VPRI, so it may just be a moment. If the Vice Chancellor could go first, that might be helpful.
Okay, certainly. Professor and Vice Chancellor John Japiong, would you like to provide your opening remarks?
Yes, thank you. And thank you for your very warm remarks in inviting us and welcoming us all into this webinar. The goal is to build a strong and resilient health system in Ghana. And I guess we want to do it through fostering effective collaboration between UHAS and YOCU. So first of all, I would want to heartily welcome all of you to the seminar. It is indeed a great privilege to have you participate in this. I have a few comments on this whole collaboration. We at UHAS really cherish and value our collaboration with YOCU. We have many alliances with other universities, but this is one that we cherish so much. Looking at the goal of the Ascent program, we are looking at increasing the number of doctoral students within our university. We want to be able to get as many faculty who have doctoral degrees to help in the training of our nurses and midwives in this university. Per the plan that we have put together, we hope that at least over the next couple of years, we'll be having 6 of our faculty obtain their PhD from YOCU. But more importantly, we are looking at developing our own graduate programs. And our own graduate programs will be enhanced when we have faculty who have attained their highest degree, which is a doctoral degree. And this is a requirement by our National Council for Tertiary Education, which is overseeing and providing oversight to our tertiary education landscape. Indeed, as we benefit from this mutual collaboration, we are hoping that this will promote diversity between us and YOCU, and that our cross-cultural experiences would enhance our outlook to life and improve upon our collaboration with one another. Beyond this, we are hoping to also extend and strengthen our research capacities through mutual collaboration, because as you would all know, doctoral students bring on board a lot of research. So this is going to help us work together in our 2 countries to ensure that we achieve our goals. Our goals are embedded within the global landscape. Inclusive and quality education is the goal that the SDG 4 aims at helping us all achieve. But for us in particular, we are looking at the focus on nursing and midwifery education, which the WHO has been promoting since the year 2020. Through this space, we hope that the proverbial brain drain and brain circulation issues will be addressed, because we think it will provide us with a very unique opportunity to ensure that, based on the kind of training that we have, our staff and our faculty are within our spaces at the times that they are needed to contribute to their work, as opposed to moving away completely to go and live in an environment which does not make them available to our students. We are committed to this, and I know for sure that YOCU is also very much committed to this. We've both made financial commitments to this initiative, and in as much as we are making substantial financial commitments to this initiative, we know that this will not be enough to achieve the long-term goals of this collaboration. And it is for this reason that we want to introduce this initiative to you so that you can all, through your very little means, contribute to support us to achieve our goals in this initiative. We are very much convinced that this is going to be a real game changer as far as nursing education in Ghana is concerned. And I'm sure you'll be happy to be part of this initiative because ultimately it will contribute to health development, and within the health development landscape, our health systems would also improve and the quality of life of our nations would improve as well. So I want to thank you all for this collaboration, and I wish you very well and enjoy this seminar. And it is also my prayer that things will move on in this collaboration to the betterment of all of us. I thank you all for your attention.
Thank you, Vice Chancellor Japiong. I believe that our Vice President for Research and Innovation, Amir Asif, is available now. So if you're available, there you go. Please, we'd love to hear your opening remarks.
Merci beaucoup, Julie. Bonjour et bienvenue. Good morning, Canada. Good afternoon, Ghana. And good day to colleagues and partners joining from other regions of the world. It is indeed my great pleasure and honor to welcome you all to today's webinar featuring Ascent Project. Ascent, as I understand, stands for Advancing Scholarship and Capacity for Emerging Nursing Doctorates, a program collaboration between York University, Canada and University of Health and Allied Sciences, Canada. Please allow me to share a brief introduction of York University. Founded in 1959, York has grown to become Canada's third largest research and teaching institution in the last 60 years. York University is a progressive and community-engaged university committed to providing a broad demographic of students access to a high-quality, research-intensive environment. Today, York has 25 interdisciplinary and collaborative research centers with strengths in vision and space sciences, history, equity, social justice and refugee studies, health, the environment, climate change, sustainability, digital media, and corporate social responsibility. In 2020, the university launched a new university academic plan 2020 to 25 titled Building a Better Future, York University Academic Plan 2020-25, which serves as a blueprint for action, positioning York University as an agent of positive change with a strong commitment to contribute to the achievement of the United Nations Sustainable Development Goals 2030. With this focus on building capacities for nursing education, training, and research, the Ascent Project exemplifies academic and community partnerships that will help advance SDG 3, namely good health and well-being, SDG 4, quality education, and SDG 17, partnership for the goals. It aligns closely with three of the top priorities in the York University Academic Plan. Number one, from access to success, where we aim to support students from all backgrounds in realizing the full potential. Number two, advancing global engagement, where we recognize that global networks allow students to learn from one another and gain global fluencies needed to work in international settings. Number three, working in partnership, where we understand that by partnering with other entities and sectors, we gain vital insights and capacity to create positive impact for our students, our campuses, and our broader communities. I would like to acknowledge and recognize colleagues leading the Ascent Project for their vision and commitment. I specifically would like to mention colleagues at York Faculty of Health, Professor Paul McDonald, Dean of, for his leadership and support to the project, and Professor Jacqueline Schweiner, Ascent York Faculty Lead from the School of Nursing, and UHAS senior leaders, to Vice Chancellor, Professor John Ogiapong, for championing Ascent, and to the faculty and program coordinators at UHAS School of Nursing and Midwifery for their continued support and collaboration. Thank you, and wishing everyone engaging and insightful discussions. Merci beaucoup.
Thank you very much. Now, I believe that if our opening remarks can turn off your cameras and your microphones, we can continue. And thank you for these opening remarks and the support received from the senior leadership at both York and UHAS for the Ascend program. So let's get started. Today's talk is titled Building a Strong and Resilient Health System in Ghana, featuring a distinguished panel consisting of faculty from York University and UHAS as key stakeholders in the Ascend program. For some context, maybe if we could start sharing the slideshow. For some context, the Ascend Project grew out of the recognition that nurses are essential to building strong and resilient health systems, and that the world is facing a global shortage of healthcare workers. Most of the population in Ghana relies on nurses as their primary healthcare giver, and yet most nurses do not have advanced skills training or may not have a degree. UHAS has been working to bridge this gap. Ghana now requires that faculty have their PhD level education, but there are a lack of programs to support PhD training in nursing across Africa. This highlights the need to increase access to training at the PhD level so that more programs can be developed by UHAS, focusing on education as essential to delivery of quality healthcare services. Through the Ascend Project, faculty at UHAS in the School of Nursing and Midwifery will receive doctoral level education as part of York's nursing PhD program to advance their skills and training. With advanced training, faculty are better equipped and able to deliver quality healthcare education to their students. And each year, more than 330 nursing and midwifery students graduate from UHAS programs. Better trained graduates means improved quality of care received by communities. The Ascend program will build stronger education and research programs in Ghana to meet the growing health needs of communities across West Africa. The Ascend Project started last fall with our first cohort of PhD candidates beginning in their first year of the 4-year program. This was intended to be in person, but the pandemic led to some adjustments for the program to be offered in a virtual format. And the first 2 years of the program involve foundational coursework, while the remaining 2 to 3 years are dedicated to community engaged field research in Ghana and for work on doctoral dissertations. The Ascend program plans to support 6 UHAS faculty to receive their PhD training over a 7-year period. You can stop the slideshow. I'm delighted to welcome 5 guest panelists today who will be introduced and asked to respond to their focused question in sequence. Each panelist will be given a few moments to answer their question before I introduce the next panelist. I'll ask that our panelists turn on their cameras once they're introduced. And to begin with, I'm pleased to welcome Irene Attachie, a lecturer with the University of Health and Allied Sciences, and one of the first 2 PhD nursing candidates completing her first year in the Ascend program. Irene holds a master's in philosophy and a Bachelor of Arts in Nursing with psychology from the University of Ghana. As a registered nurse and midwife in Ghana, her role in education and clinical training has focused on health issues and specifically midwifery practice and stillbirth care. For her PhD, Irene will explore and develop a response plan to help women manage the profound pain and psychological suffering that comes from stillbirth, examining different areas of grieving and loss. Irene plans to develop a protocol within the healthcare system to better support people in Ghana. Irene, welcome. Could you share with us what this program means to you and what you hope to accomplish?
It's not me. you. Thank you. I believe you could hear me. Right. I'm very privileged. Thank you, Julie. Good morning, Canada, and good afternoon, Ghana. And hi to everybody on this network. I'm really privileged to be on this platform this afternoon. What the Ascent program is to me. Before I do that, let me talk a little bit about how it became actually Ascent and UHAS this link, finding me in between. In the inception of the university in 2014, as part of the appointments that people who were given appointment, people holding MPhil were also offered appointments as lecturers to teach in professional courses like midwifery, which I do, and I'm one of such people. As the university is progressing and having a scope and increasing our level of the degree that we award, it has become necessary that those of us who are at the level of masters pick up and then move on to the PhD level so that we would be able to give service that will commensurate the degree that is being awarded in the university. And it will also help to support the health system that we are running in Ghana and globally. Therefore, it became necessary for me to partake in the PhD. As a lecturer, I should be able to take care of my PhD expenditure. However, being a mother and then a pillar in my family, I had younger ones who looked up to me. So then an opportunity cost was staring at me. Am I doing the PhD and the younger one suffers no education to have? Or I decided to support them and then move on as with time. And today, Ascent program was presented to us, and it's a very big gift to me personally, because the two universities have come together to collaborate and made it possible for me to get into the PhD because the two universities are supporting us in one way or the other. And for me, my family, and my school and departments, it is a big gift unto us. And we say thank you for the people who dreamt, and we want to thank in advance every other person who would want to support. But what is the value of the Ascent program to me and what I do? Looking at my research base, I believe when I am done, only 1 year into the program, I bet you I have seen different forms of research that I never thought were research. So see, a lot of learning has already gone into me, and I believe this is going to have a positive impact on my students' subsequent research, because as I learn, I would impact on them. And it is going to also show up when they step out into the field to do their research, to give care. And globally, I know this is going to enhance us. There's going to be a global boomerang of the effect, because almost our students are out there, some are in UK, and so that what we get at the end of this program is going to be a global reward. And so I want to say that it's a great program. Ascent has come to give us equity, and it is giving us also the chance to learn further and share with what we have globally with the rest of the world. Thank you for now. Thank you.
Thank you, Irene. Our second panelist, Milipaak, is among the first cohort of Ascent PhD nursing candidates. As a faculty member of UHAS, Japiong holds a master's degree in advancing nurse practice from University of Cape Coast and a Bachelor of Science in Nursing from the University of Nursing in Ghana. Oh, sorry, University of Development Studies, both in Ghana. Japiong's research interest focuses on the barriers and facilitators to healthcare in Ghana for people with kidney disease. People requiring hemodialysis for their kidney disease face several challenges, including access to treatment and soaring costs. Japiong will examine the patient experience with the health system, including the level of knowledge of nurses required for providing this treatment, along with policy options to support those who cannot afford the required care. Milipaak, similar to Irene, could you please share with us what this program means to you and what you hope to accomplish?
All right, thank you, Julie. And then good afternoon to my colleagues in Ghana, and good morning to those in Canada. I'm happy to be part of the York UHAS family, and I must admit that so far it's been a good learning experience for me. And I can say that York and UHAS is setting me on the path towards a promising future. And so as a faculty in the School of Nursing and Midwifery, my mandate basically includes teaching, conducting research, providing community service, supervision, and mentoring of students. So this program, I see it to build on my research skills and strengthen my ability to conduct cutting-edge research that would advance the science of nursing and improve the quality of patient care. And I think that the theoretical knowledge and practical skills that I will acquire will help in the training of the next generation of nurses in Ghana using evidence-based practice, and therefore I'll be able to link theory to practice. Nursing students require education that integrate evidence practice knowledge across the classroom and the clinical settings. And so I'll be able to teach at different levels of nursing education using modern methods. But there's a shortage of nurse scholars and professors in Ghana to provide the required training to meet the growing demand of the Ghanaian population. So an increase in the number of nurses with doctoral education will provide the foundation for specialized education that will have greater impact on addressing health needs in communities. The World Health Organization estimates that about 1.3% of the world health workforce reside in sub-Saharan Africa. Yet the continent assumes about 25% of the global burden of disease. So a continent where its people experience about 25% of the global burden of disease only have about 1.3% of the healthcare providers. And health workforce related challenges therefore remain one of the major threats to the attainment of Sustainable Development Goals 3, universal health coverage or good health and well-being, especially in the African region. So in the midst of COVID-19 pandemic, it has taught us to build strong and resilient health systems that will be able to respond to the needs of society. And so therefore, nursing being the world's largest single occupation in the health sector, nurses will play a key role in the building of strong and resilient health systems in Africa and the world over. By training, therefore, will have an impact on the wider society in the training of the next generation of nurses in Ghana, Africa, and the world at large. And I'm positive about possibilities for knowledge translation from York to Ghana upon completion of the studies. And I'm poised to make contribution to knowledge in a way that will benefit people in Africa and the world at large. And I'm convinced studying at York University will broaden my worldview and my understanding of issues as a result of the cultural environment, with emphasis on the 4 pillars of nursing education. So nursing practice, nursing education, research, and leadership. Thank you for your attention.
Thank you, Japiong. As a reminder to our guests, please use the Q&A function at the bottom of your screen to ask questions. So these can be addressed after we've heard from the 3 remaining panelists. Now, Professor Ernestina Doncor is the acting dean of the School of Nursing and Midwifery at UHAS. Having a long and successful career as a midwife, a nurse, academic, and researcher, including 17 years of teaching and research experience at the University of Ghana, she is an expert in the development of curriculum to support advanced education for nursing in Ghana. Dean Doncor pursued her PhD in nursing through King's College in London and has been a leader in nursing education in Ghana. Dean Doncor, can you turn on your camera? Thank you. I'm going to ask you a different question. What do you see as the longer term benefits from this collaboration?
Thank you very much, Julie. Good day to everybody. There are a number of benefits that can be shared. The intent of the partnership is to produce a number of faculty with PhD degrees in nursing. The main thrust is to build nursing education and research capacity. So with increasing number of PhD holders, more nursing students are going to benefit from an enhanced quality nursing education program, which will obviously impact on their service. Some of the neighboring West African countries will also benefit from an increased well-trained health workforce. There will be increased ability of nurses to meet the health needs of communities and populations. And then coming to think about leadership positions, there will be more nurses taking up leadership positions in education sectors, healthcare sectors, ministries, among others. More nurses with the requisite knowledge and skills could also be contribute to policy development. Now, with the intensive engagement of faculty and students over time, will contribute to building networks of relationships and mutually supportive research and teaching, learning interest. And then when you consider the movement of faculty and students between the two universities, this will enhance internationalization. The academic experiences of students and academic staff will be broadened. And then research collaborations between health researchers at the two universities will be established. And then my last point is that there will be more postgraduate programs that could be run in the school to enhance research and scientific knowledge. Thank you very much.
Thank you, Dean Doncor. Our fourth panelist, Robert Kaba Al-Hazan, is a senior research fellow and acting dean of international programs at the University of Health and Allied Sciences. A registered general nurse by profession, Robert has worked in the clinical setting for several years and has taught in several health training institutions in rural and urban Ghana. His passion is to mentor and empower the next generation of nursing scholars in Ghana and beyond, and you'll hear that he's quite clear on that. Robert's research interests include health policy, health financing, implementation research, neglected tropical diseases, and evidence-based clinical practice. Robert, can you turn on your camera? And let's see, and we had a bit of trouble with Robert's camera earlier. Go. Wonderful. Would you be able to tell us what conditions in Ghana spurred UHAS to pursue this collaboration?
Thank you very much, Julie. And good day to all our colleagues who have joined us. If I understood your question right, basically, you are, if you wouldn't mind, just to give a second shot of the question so I'm clear.
Yes.
On it.
So what conditions in Ghana spurred UHAS to pursue this collaboration?
Great. Yeah, so for me, the conditions are what my colleagues have already alluded to, because there are conditions of need for higher level education for nursing scholars. We currently also have conditions of serious needs in terms of higher level education. And here we are talking of nursing faculty. We have a younger generation of nursing scholars who are coming up in the various public universities, but they don't have the requisite terminal degrees. And here, if you talk of terminal degrees, we are looking at those who have PhDs, because that is the requirement per national standards for one to be able to lecture in the university. And fortunately for us, unlike the past where the highest level of education a nurse would have those days is a diploma. And even as we speak, we still have nurses with certificates. And the world is really getting dynamic in terms of nursing and the trajectories towards getting the higher level qualifications. So for me, the number one conducive environment for this particular collaboration is the increasing need for nursing scholars at the pinnacle of the profession. People who have the higher level of, and the dean has rightly mentioned that the School of Nursing and Midwifery in UHAS, for example, is training nurses throughout the country and even neighboring countries. And here is the case, we don't have all the faculty having their PhDs. So that for me is one key thing. And the other need really has to do with the current gap in the evidence-based nursing practice. We have a lot of nurses in the system who are practicing based on what they have known in the past, the try and error kind of approach to things without it getting the necessary scientific backing. And if we begin to have people who have this level of training and they understand the science of what they do, then I can assure you that the profession in the next few years is really going to be at a different level, unlike what we have now. So for me personally, this is really, really timely. It is the time that we need to hit hard now that we have these kind of opportunities coming our way. And I want to believe that the UHAS Ascent program is, like the VC mentioned, is one of those that we cherish because it is teaching UHAS how to fish and not fishing for UHAS, as we always have it in most of the collaborations. So in summary, I would say the conditions are local conditions that are ripe at the institutional level and then also at the national level in terms of policy, and the need for nursing to match up to other healthcare professionals. And let's not forget, nursing is actually the backbone of every health system, not only in Ghana. And without nurses, you don't have a health system. And you cannot continue to have nurses who don't have the right level of education to lead this. So that's what I have to say. And I want to believe that once the questions come in, we would continue with the deliberation. Thank you.
Thank you, Robert. I'd like to introduce our final panelist for this morning, Dr. Jacqueline Schweiner, Associate Professor and Graduate Program Director for the School of Nursing at York. Jacqueline's area of research focuses on the influence of political, economic, and social forces on the quality of care and the quality of work and life for nurses and other healthcare providers. In her role as Graduate Program Director, Jacqueline has been involved in coordination and support for the Ascent program. Jacqueline, could you turn on your camera? I wonder if you could share with us the importance of the Ascent collaboration for the School of Nursing and its PhD program at York.
Thank you, Julie. Hello, everyone, and I'd be delighted to share with you. Thanks very much. Certainly, the global pandemic has highlighted, along with so many other reasons, the need for collaboratively developed health priorities in the global north, by the global north and the global south. And it has underscored the fact that we are all in this together and we all have much to offer. And this is certainly in line with the United Nations 2030 agenda and the Sustainable Development Goals that a number of my colleagues have already spoken about. So this is why we are so very excited by this collaboration and about the possibilities that it opens up between the faculty and students at York and the faculty and students at UHAS. And I want to underscore that there is strong mutual benefit here. Ghana, a regional and global leader in championing the Sustainable Development Goals, seeks partnerships to improve access to education. And York is committed to global partnerships, accessible education, and health for all through sustainable development. And I want to add something already a number of colleagues have added. Nurses are integral to this achieving health for all and building strong and resilient healthcare systems, and PhD prepared nurses are also key to this achievement. So what sort of opportunities does the Ascend program offer us for this type of engagement? Well, it is the opportunity through classroom engagement, classroom interaction that's going on now, as you've heard, with our students. It offers the opportunity for faculty exchanges and also for research collaboration. And as I'll demonstrate in a minute, those are already in play. And even at this early stage, our faculty here at York are telling us that they've already noted the benefits of having Ghanaian students with our PhD students in their classroom. Their value in learning about the similarities and differences in nursing across the globe, how students from different contexts and social locations contribute to a richer exploration of key concepts, the opportunities for faculty to build on each other's knowledge and expertise, and the co-development of research grants among faculty and also between faculty and students. So together, York University School of Nursing and the School of Nursing and Midwifery at UHAS are beginning to forge and will continue to forge new pathways in responding to some of these pressing health issues. So our partnership has will not only produce 6 new PhD students from UHAS by 2027, but it will also enrich the diversity of York graduate nursing programs, benefiting our students and our faculties. And it will expand our capacity for collaborative research and graduate supervision in both UHAS and York University. This partnership lays the foundation for collaboration and knowledge exchange and will promote sustainable solutions and quality care in the global health arena. Thanks so much.
Thank you, Jacqueline. So now I think what I'd like to do is ask that all of our panelists turn on their cameras, and we're going to open up the Q&A session. And so I'm actually receiving several questions in the chat box now. And so if any further questions are asked from the audience, please feel free to use the Q&A box to add to them. So we'll go through, and I'm hoping to put them into themes and ask one clear, concise question for our panelists. So to start off, this question comes to any member of our panel, but probably I'd like to direct it perhaps to Milipaak or Irene. And that is, what do you see will be the key outcomes from this program for your students? It can also be answered from Jackie at York if you'd like.
I think I've had the key outcome of Ascend, Ascent, we're climbing up, right? The Ascend program to my students. I already have a good professional teaching relationship and outcome. So the improvement in the research, my research base and my research knowledge, now that my research knowledge is becoming broader, I believe, first of all, what I can immediately talk about is what I thought were the traditional research areas now has widened. For instance, now you think about the indigenous research, and I see myself guiding some of my students into tapping into the history of midwifery, how it started, even maybe with the traditional birth attendants, to understand the profession better. So this is just a little bit of what I could just give as an example of what is going to be new, so that at the end of the day, we could also say that when we have taught them based on scientific findings, then as clients, our students are going to give off evidence-based service, which is going to be actually tuned to the indigenous theories, okay, theories that have been developed in Africa and in Ghana, so that it makes it very usable. And when they are practicing with usable theories, I believe the care will be what is expected to be. This is just a little bit of what I want. Milipaak, take off, and maybe you can continue. Thank you.
Jacqueline, actually, would you like to respond?
Sure, sure. I did touch on this already, but we certainly see it deepening and enriching the experiences, the PhD experiences of our students, and the amount of sharing that is going on between students, and also the number of research initiatives that have already begun is very exciting. And collaborations that are going on between the two schools is really exciting.
Thank you. I'm going to move on to the next question. And basically the question is, how does the Ascent program address the issue of brain drain from West Africa of healthcare workers? There was a question also related to just the format. Again, if there could be some clarity of where people are actually studying. And maybe I would like to actually ask if the Vice Chancellor Japiong would like to answer this. I notice he's off camera. Okay, perhaps Robert, would you be able to respond to that question?
Yes, let me step in. I'm sure when he's back, he might add on. For me, brain drain has always been a concern for many developing countries for obvious reasons. There are a lot of wide disparities between countries in terms of work conditions. And most of the time, those of us in the relatively underdeveloped setups tend to have the best of conditions for our health workers. So the few who get opportunity to, go up north in terms of the West, they would most of the time want to stay. And this is quite common among some faculty members. I'm not sure if this has happened to UHAS, but we know it has happened in a couple of public universities where faculty go out there to pursue their PhDs and other programs, and then they get juicier work conditions, and the temptation and the rational decision for one to just stay over because the conditions are better. And most of the time you cannot begrudge them because they might have made this effort on their own. Maybe they fought for their scholarship on their own without the facilitation of the local institution. So, the opportunity comes and then they just grab it and they don't come back. What I think is unique about this collaboration is we are not likely to experience that. I'm not sure Milipaak and Irene would just vanish once they come to Canada. We look for them and we don't see them again. Because this is a partnership that the terms are clear, have the opportunity to have the local touch and also go over there and get other kind of experiences. And at the end of the day, the commitment to come is there. They have the support of the local institution. UHAS is doing the facilitation. York is also doing its part. And at the end of the day, they see that there is that joint commitment to see them through. And most of the time, the allegiance is deepened once you have this kind of arrangement. So for me, the issue of brain drain will be addressed largely because of the bi-institutional kind of partnership that we have charted for these colleagues of ours. And I want to believe going forward, this is what we should be looking at and create even more of such opportunities for other faculty members and be looking beyond 6 candidates. And maybe if things work well, we might be looking at scaling this up to other schools, even beyond the School of Nursing and Midwifery. Thank you. And I believe the VC would want to add.
Oh, well, I think you've said it as far as the uniqueness of this partnership is concerned, which would facilitate retention of the trained faculty because of the circumstances under which we're working. So we would want to facilitate that and also get opportunity to get some of the brains from the Canadian end also circulates amongst us so that we share our common knowledge to improve upon the lot of all of us. I believe that capacity building and development is something that is continuous. And even after PhD work, the postdoctoral research, and all the things that go with it will enhance our collaboration such that there'll be so much for us to share amongst ourselves, and it will not be a one-sided movement. Thank you.
Thank you. So we're getting quite a positive response in the chat or the Q&A from people who are really loving the sound of this program and wanting to know whether or not it can be applied in Nigeria and other parts of West Africa, which is very exciting. But I think the big question that people are asking now, and before I ask it, I'm actually going to invite Dean Paul McDonald, if you're able to turn on your camera as well. So I'm going to direct this last question to both deans. The Dean Doncor can begin, and then I will ask Paul to respond to it following. And the question is, what do you feel we still need to do to make this PhD program a success? And how can people who are listening support this program? So Dean Doncor, would you like to begin?
Yes. Thank you again, Julie. As can be seen from the discussion that has gone on so far, the Ascent program is a good initiative aimed to produce a number of PhD holders in Ghana as, for nursing. As we all know, PhD training is capital intensive. That requires a lot of funds. The York University and the University of Health and Allied Sciences in Ghana have laid down the foundation for the program and are investing resources to ensure that the program runs. However, there is still the need for additional financial support in order to realize the full benefits of the program. In this regard, we would greatly appreciate the kind donations from individuals, groups, agencies, and corporate bodies, among others. We will be supporting a worthy cause that will, in the long run, contribute to improving the health delivery in Ghana and the world at large. We thank you all in advance for your generous support. Thank you.
Thank you, Dean. I think I would characterize three things just off the top of my head. Our needs are for champions, for resources, and for additional partners. By champions, I mean we would benefit from having more individuals who help spread the word about this particular program, how important it is to Ghana and potentially beyond, including but beyond nursing as well. People who will help us to keep doors open and open new doors for us. I think the secondary resources Dean Doncor has spoken about, our partners are collectively contributing literally tens of thousands of dollars a year towards the program to make it a reality. But current resources mean that we have to limit, unfortunately, the number of worthy people that we can accommodate in a given year. And it may limit our ability to potentially expand the program beyond nursing in the future. We need additional funding to sort of help students offset travel costs, for faculty to move back and forth, for students to undertake thesis projects that will advance nursing care in Ghana. Picking up on the last question about reducing the risk of brain drain. The program has specifically been designed so that students spend some time in Canada, but they have to complete the program by returning to Ghana. And the idea is that the final stages of the program involve undertaking research and doing that research in Ghana and on topics that will enhance the development of healthcare in that wonderful nation. So it's been designed in that way, but it does require funding to undertake those worthy research projects. And of course, not all of the faculty and students who might benefit from the program are necessarily able to access it. Certainly the inch of our institutions are contributing, but so are the individual students. And it does require some sacrifice, as one of our panelists mentioned. And so what it means then is that some worthy individuals may not have an equal opportunity to participate. And so the ability for us to set up financial supports and scholarships for students would greatly level that playing field. And then finally, partners. I think we are looking for additional organizations that can enable our students to gain some experience in Canadian healthcare settings, and for our students and our faculty to also gain a better understanding and appreciation of the health system and its needs in Ghana. And that requires partnerships and collaboration with organizations beyond our respective universities. So I think those are three areas where we can always use some assistance. Thanks for the question.
Thank you, Dean McDonald. I'm aware that we are coming to the end of our session. So I just wanted to invite if there were any other further comments to be added by our panelists. Okay, then without further ado, I want to thank all of our guest speakers today, Professor and VC Japiong, Professor Attachie, Japiong, Dean Doncor, Robert Alhassan, Professor Choiniere. Thank you so much for spending this time with us and sharing all of your insights. I hope I didn't leave anybody out, but we're very grateful to have all of you here and for our guests as well. So for more information on how to connect with the program, if we could ask our speakers to turn off your slides and your videos, and thank you very much. But before we do say goodbye to you, we want to thank you and our audience again for taking the time to join us. Please feel free to share today's talk with your guests. It will be posted and shared with you after this event. So thank you, everyone.
Thank you.
Thank you.
Thank you.
Thanks, everyone.
Thanks.